everyone, and welcome to week 10. This week, we're going to be talking about more about cancer, which is related to chapter 10 in your textbook. This week's objectives include being able to distinguish between different subtypes of breast cancer, understanding how cancers are staged, differentiating the different cancer treatment options, predict treatment plans for patients, describe the cancer risks that have been linked to HPV infection, to find the benefits of HPV vaccination, and provide current information from the CDC on vaccination recommendations. This week, you'll be reading Chapter 10, view the Chapter 10 PowerPoint, read the HPV overview, which is the human papillomavirus. Go through the following websites: HPV in men, HPV vaccination information, and pap smear information. The assignments for this week include the pap smear reading reflection blog, the cancer treatment options assignments, and of course, your discussion board. The pap smear reading reflection is asking you to go through a website and select one passage from this reading that gave you some new insight or significant information. I then want you to write the passage in the blog and talk a little bit about why you chose that particular passage. So let me quickly show you the website you will be working with. For the pap smear one is the pap smear information clinic from the pap smear information from the Mayo Clinic website. And so here you can just see the explanation for pap smears, what it is, what the results mean, and things like that. So again, you'll pick one phrase from this website and talk about why you picked it and why was it significant for you. The second assignment is writing about different cancer treatment options and creating a brochure. As you can see here, create a brochure on one type of cancer treatment. And so again, your textbook also has a lot of information on cancer treatment, but I have provided, a website here that again talks about different types of cancer treatment. So you're going to choose one of these. You would click on whichever one you want to choose and create a brochure on that one specific cancer treatment. So this week, as I've mentioned, we are going to be talking about different treatment options. Excuse me. The first one is biological therapy. And what this does is it binds to sites on cells and blocks proteins that allow those cancer cells to grow. So this is a drug, and the side effects is it can affect the heart's ability to pump blood. The second one is chemotherapy. Now, chemotherapy destroys cells with anti-cancer drugs. And basically what chemotherapy does is it kills fast-growing cells. And so cancer cells, as you recall from last week, are fast-growing cells. Now, one of the side effects of chemotherapy is hair loss. And the reason hair loss occurs is because hair is a fast-growing cell. And so therefore, as chemotherapy is targeting fast-growing cells, the hair growth, which is a fast-growing cell, is also targeted. The next is hormone therapy. This prevents cancer cells from getting or using the hormones they need to continue to grow. This is also drugs and also possible surgery to remove ovaries. The side effects of hormone therapy, though, are symptoms of menopause. And again, the patients have to test positive for estrogen and progesterone receptors. The next treatment is radiation therapy. And again, this destroys cells with internal or it could be external radiation. You need a source of radiation. Some of the side effects are redness, swelling, and fatigue. And then last is surgery. And so surgery removes some or all of the cancer cells or tissues. You need anesthesia, a scalpel, a physician, a surgeon. Side effects are the wound infections. So wherever they have made the surgery, that part can become affected. There's pain, there's tenderness. And depending on what type of cancer, patients are recommended to remove part or all of the breast. look at cancer in women, for cancer, it is the second leading cause of death in the United States for all people. 75% of cancers are diagnosed in people like 55 and older. Breast cancer is the most common cancer in women. The second most common is lung cancer. But lung cancer is the one that causes most deaths. It has the lowest survival rate because by the time lung cancer is actually found and diagnosed, it tends to be at a later stage. In women, the third most common cancer is colorectal, and the fourth most common cancer is endometrial. When we think about breast cancer, one thing to keep in mind is that at some point in a woman's life, they will find a lump in their breast. In 9 out of 10 of those cases, it is not going to be cancer. There are reasons that that lumps form in breast, which include having a fibrocystic breast disease, which also includes cystic mastitis, hyperplasia, fibroadenoma. And remember, those conditions are not cancerous, but those could be reasons why there are lumps in the breast. To look at risk factors for breast cancer, obviously being female, females do have a much higher risk factor of breast cancer. 90% of all breast cancers are in women, although 10% do occur in men. Age, as you get older, your risk for breast cancer increases. Having a family history of breast cancer, never having children or having your first child after 30, having early menarche, which is your period is at an early age, so before 12, or having late menopause, which was after 55, consumption of a high-fat diet or a high alcohol intake. There are some environmental risk factors. Obesity has been linked with higher risk of breast cancer, and there's mixed data on oral contraceptive use. So your breast anatomy, breast cancer can develop in different parts of the breast. It can be in the lobules, which are over here. It can be in the ducts. You can see the ducts over here. Or the ducts, which can travel from the lobules to the nipple. Breast cancer that spreads outside of the breast may invade nearby lymph nodes. You can see the lymph nodes on the top left picture. It is the highlighted white circles. When doctors are considering the type of treatment for breast cancer, they first need to know at what stage of the disease the person is in. The stage is based on the size of the tumor and whether or not it has spread. So the stages are stage 0, 1, 2, 3, and 4. Stage 0 is carcinoma in situ. This means that the cancer is confined to wherever it originally developed and it has not invaded surrounding tissue. Stage 1 is an early stage of invasive cancer. The tumor is 2 centimeters or less, and there's no cancer cells outside the breast. When you think about what size is 2 centimeters, it's about the size of a shelled peanut. Stage 2, cancer must meet one of the following conditions. So stage 2A is that the tumor size is 2 centimeters or less, and the cancer has spread to underarm lymph nodes, or the tumor size is between 2 and 5 centimeters, and there is no cancer outside the breast. Stage 2B is the tumor size is between 2 and 5 centimeters, and the cancer has spread to underarm lymph nodes, or the tumor size is greater than 5 centimeters, and there's no cancer outside the breast. So those are the two conditions for stage 2. Stage 3 is considered locally advanced cancer. That's divided again into 3 categories. So stage 3A, the tumor size is 5 centimeters or less, but it has spread to more than 3 lymph nodes under the arm, and maybe either alone or attached to other structures. Or the cancer has spread to lymph nodes behind the breastbone. The other condition is that tumor size is greater than 5 centimeters. The cancer has spread to 3 or more underarm lymph nodes and may either be alone or attached to each other or other structures. Or the cancer may have spread to the lymph nodes behind the breastbone. Stage 3B is a tumor of any size has grown into the chest wall or the skin of the breast. It also may be associated with swelling of the breast or nodules in the breast skin. The cancer may have spread to the underarm lymph nodes which are attached to each other or other structures, or the lymph nodes behind the breastbone. And then stage 3C is a tumor of any size which has spread to either lymph nodes behind the breastbone and under the arm, or the lymph nodes above or below the collarbone. And then finally, stage 4 is distant metastatic cancer, and this is where cancer has spread to other distant body parts. Next cancer we're going to talk about is cervical cancer. Cervical cancer, as you may have heard, is caused by a high-risk strain of HPV, or human papillomavirus. So modern medicine has potential to prevent almost all cases of cervical cancer through the use of screening, vaccination, and treatment. So screening is done via pap smears and HPV tests, and those are recommended for women age 30 and over. Vaccinations can prevent most, not all, but most of cases of cervical cancer, and screening is still needed. And then treatment is cytosurgery, cone biopsy, laser cone biopsy. So human or cervical cancer is caused by the human papillomavirus, which is a really common STD or STI. Holding high-risk strains of HPV can cause cervical cancer. It's important to note that most women with high-risk HPV will not develop cancer, and in fact, your body can eliminate it on its own. But in cases where your body cannot, this is where the vaccine comes into play. So it's easily treated if found early, and again, you find it early through pap smears and having the HPV test. And as I mentioned, the vaccine can protect against some high-risk strains of HPV. Let's talk a little bit about what HPV is. It's the most common sexually transmitted infection in the United States. It's transmitted person to person by close sexual contact. Most people with HPV are asymptomatic, meaning there's no symptoms, and they often don't find out until years after being infected that they have HPV, which makes the virus easier to spread. If you don't know you have the virus, you have no idea you're spreading it. Most sexually active females and males will be affected at some point in their lives with HPV. That's how common it is. It's estimated that currently almost 80 million Americans are currently infected with it. There are 14 million new infections each year in the US, and it's most common for people in their teens and early 20s. There are 40 different types of HPV strains. As I mentioned earlier, most go away on their own and do not cause health problems. Cases that do not go away can cause serious health problems, such as genital warts or cancer. And you can see here, it's not only cervical cancer that there is a risk factor for, there's also vulvar, vaginal, anal, penile. So that's why it's important that males also be vaccinated against HPV infections, because it can infect and increase the risk of cancers in men as well. There are many different types of HPV, as I've already mentioned. There are harmless ones which cause no warts, no cancer. There are ones that cause genital warts, and then there are ones that cause cancer. In most cases, most of them will clear up on their own, but some will persist. So some will persist and there'll be no abnormalities in the cervix. Some will persist and there'll be some abnormalities in the cervix. And a few will persist and progress to cervical cancer. What happens is with HPV is that the virus penetrates the cervix. So you can see here the virus is the blue and aqua circular shape, and it actually inserts itself into the layers of epithelial cells, those surface cell layers in the cervix. The virus then uncoats itself, and it starts to create more viruses using the RNA in your body. The virus also disables suppressors, and if we recall, suppressors are sort of that stoplight that stops cells from reproducing when something is wrong, right? And so when these are suppressed, the cell will continue to divide even when something is wrong. They're virus-like particles, and we should talk a little bit about some of the prevention strategies. Vaccination. These are safe and effective vaccinations, and they're recommended for certain age groups, generally before the age of 13, so before a teen is sexually active. In addition, screening is really important. The screening recommendations for women to have pap smears starts at age 21 to detect cervical cancer. So at 21 is when it is recommended women have pap smears. And then to engage in safer sex. So if you are sexually active, make sure that you are using condoms, that you are in mutually monogamous relationships. The less variety of sexual partners you have, the less your risk is. The more sexual partners you have, or the more sexual partners your partner has, the increased risk you are at. The two major vaccinations in the United States are Gardasil and Cervarix. And what you can see here are the different types. So there's HPV-4, which protects against 4 strains of HPV. There's the HPV-9 that protects against 9 strains of HPV. And again, most of these are the ones that cause cancers and warts. It's licensed for males and females from 9 to 26. And it's a 3-dose series. So you have one, you have your first one, then 2 months later you have a next one, and then 6 months later you have your last one. Cervarix currently protects against 2 of the HPV, 16 and 18. Those are the ones that are known to cause cervical cancer. Now these are recommended for females aged 10 to 25, and again, it's a 3-dose series. There are 3 different types of HPV vaccines. There's bivalent, quadrivalent, and nonvalent. So bivalent is bi-2, protects against 2 types of HPV strains. Quadrivalent is 4, so quad is 4, so protects against 4 strains. And then nonvalent, I don't know why they didn't use the official word for 9, but that protects against 9 strains. In my opinion, I would imagine that taking the one that protects against 9 strains is best, right? Because you're covering more strains. So HPV vaccination is most effective when it's administered before exposure to the virus, and usually exposure to the virus occurs through sexual activity. So you want to make sure to give it to people before they are sexually active. An age recommendation on these vaccines are based on research on safety and efficacy. So how safe is this and how effective is it? The average age of sexual debut in the US, meaning what is the average age that people first have sexual intercourse, and just cost-effective evaluations. When we look at reasons why girls are not vaccinated, and these were asking parents, because obviously girls are not going to their parents saying, hey, vaccinate me against HPV. So these are reasons parents give for not vaccinating their daughters. Lack of knowledge, they don't believe it's needed or necessary. They have safety concerns or concerns about the side effects. It wasn't recommended to them, and their child's not sexually active. The top 5 reasons parents give of not giving boys HPV vaccinations are not recommended, it's not necessary or needed, lack of knowledge, their child is not sexually active, and they have safety concern about or side effects concern. So basically, these are the same reasons provided, just in a different area of what they felt was important. We look at other gynecological conditions. Another condition is called benign uterine conditions. Benign meaning non-cancerous. So the items that fall under here are fibroids, endometriosis. Endometriosis is when cells grow outside the wall of the uterus. Endometrial hyperplasia. And for these conditions, treatments include hormone therapy. Sometimes it could be surgery. Malignant uterine tumor. So malignant means cancerous. So risk factors for these are being over 50, being obese, having diabetes, high blood pressure, and smoking cigarettes. Early menarche or late menopause. So again, having your period at a young age or having menopause at a late age. History of infertility, having a family or personal history of other cancers. Long-term high dose of ERT. Use of tamoxifen for breast cancer. And these are sometimes difficult to detect because it's too high up to be found on a pelvic examination, or when you have a pap smear, you also have a pelvic examination. So it's too high up for the physician to feel. For this, treatment may involve surgery and or radiotherapy. Ovarian growth, so there again are two types: benign, meaning non-cancerous. These are either cysts, which could be follicular, hemorrhagic, epithelial, dermoid, or polycystic ovarian syndrome. The other type of growth are ovarian cancer. So again, cancer cells, and this is deadly. That's a largely misunderstood form of cancer. The risk factors for this is no children, early menstruation, so again, having your period at an earlier age, or late menopause, so having menopause at a late age, pregnancy after 30, previous cancer, and having used long-term use of some fertility drugs. Early symptoms of ovarian cancer include having a pelvic pressure, abdominal swelling, gas pains, indigestion, and then just vague abdominal discomfort, meaning like your stomach region hurts, there's some discomfort, but you can't quite pinpoint where it is. And treatment for this is surgery, radiotherapy, and chemotherapy. Colorectal cancer, risk factors for this include increasing age, that there is familial polyposis. Those are major risk factors. Having a high fat, low fiber diet is also a risk factor. And some warning signs are having blood in stool. Anytime there is blood in stool, you need to get it checked out right away. It indicates something is wrong. And having cramping in your lower abdominal region. Screen for this is a digital rectal exam. Fecal occult blood testing, maybe they'll test your fecal matter or your poop, and having a colonoscopy. And then treatment is surgery, radiotherapy, or chemotherapy. Next, we're going to talk about skin cancer. So these are two types. There's melanomas and non-melanomas, or basal cell and squamous cell carcinomas. Risk factors are UV from sunlight, having a lot of moles, having a family history, and also race. Generally, the lighter you are, the more at risk you are. And things that you should look for on yourself include looking at moles or freckles and looking for asymmetry. So the edges are not, one side is not equal to the same. Border irregularities, so there isn't a clear distinction of a border for the mole or freckle. There are color irregularities, so the color is not uniform amongst the mole or in the mole, and the diameter, so the larger, the more concerned you should be. For these, the treatment could be surgery, radiation therapy, electrodissection, cytosurgery, laser therapy. I mean, generally, they remove the freckle or the mole, and in most cases, you don't need further treatment as long as you find it early. That concludes our show, our video for this week. Have a wonderful week, and let me know if you have any questions or concerns.